Hi, my name is Maddie Albornoz, and tonight we'll be looking at an article entitled Common Blood Pressure Medicine May Work for Malaria Too. As you can see on the map provided, Sub-Saharan Africa has a disproportionate amount of malaria cases. They have about 90% of the world's total burden. This includes the majority of deaths due to cerebral malaria, and the majority of the population that gets killed are children under 5, the world's most vulnerable population. Researchers from the NYU Lagoon Medical Center, with help from colleagues in Spain and Germany, believe that they have found a solution to many of these deaths. Scientists in these areas have been running trials on lab mice where they treat mice that have cerebral malaria with a mixture of normal malaria treatments and a very common blood pressure medication that we call Avapro in America. Avapro, that can be bought at about $4.50 per pill in the United States, can be found in India for just 11 cents per pill. The research has shown that each patient with malaria would need only a couple of pills to reach full recovery. With the researchers' incredible success with the mice, it only makes sense to begin human trials. Major stakeholders and players in the situation include people who are infected with malaria, people who are at high risk for being infected with malaria, which according to the World Health Organization data is about half the population, pharmaceutical companies, epidemiologists, outreach workers, governments of high-risk countries. All of these people are really main stakeholders in this problem. This research is so important because even with our about 37% drop in risk and prevalence over the past 15 years, there are still hundreds of thousands of children dying from this every year unnecessarily. The strain of malaria that I've been talking about in the majority of this video is called cerebral malaria. This malaria causes severe brain hemorrhaging when parasitic-infested red blood cells begin to clot and move towards the brain. The blood pressure medication Avapro or other generic forms of that same medication have been known to thin the blood enough to prevent these clots from happening. Those directly affected by this discovery would be half the world's population that are in severe risk of getting any form of malaria, including cerebral malaria. The two other major stakeholders that will be directly affected by this are healthcare professionals and outreach and relief workers. All of these parties have a direct impact on treating those who are affected by this illness. With a more effective treatment, their jobs will be able to help more people. The two major parties that are indirectly affected by this are large pharmaceutical companies and policymakers in both world superpowers and developing countries. The predominant theory in this article is that the blood pressure medication Avapro or another generic form of that same medication could lower the risk of death for anyone suffering from cerebral malaria by a significant number. Though they don't have exact data because it may present differently in humans than it does in mice, I think that the current research warrants a human trial. Though the treatment is brand new and this would be the first run of trials with it, the people taking this blood pressure medication would not be the first people in the world to take it, and the risks of taking that blood pressure medication are low enough that the reward of being healed of cerebral malaria is higher. A more specific suggestion would be to start these trials in the areas where the endemic levels of malaria are at highs. This would be Sub-Saharan Africa and other places around the equator. I am concerned about the long-term effects of the drug. This could be an immediate solution to save a child or anybody's life, but we really don't know enough about the potential damages from this drug on the young body. Another main concern is the potential backlash that these trials could face from major pharmaceutical companies. It makes significantly more sense to choose the generic option made in India that would cost less money, though pharmaceutical companies in the United States and in other developed nations may have something to say about that. With these concerns and considerations in mind, I still suggest that we begin human trials immediately. The potential saving of lives is much more valuable than lawsuits that we may have in the future for using a generic brand of a drug to treat hundreds of thousands of people. Thank you so much for watching my video. I really hope you enjoyed it. This article can be found on the New York Times webpage, and it is called Common Blood Pressure Medication Can Work on Malaria Too.